Welcome everyone. It's definitely a milestone episode today under Transliterature series. This is the 140th episode, and we have a very, very special guest today to mark this occasion, joining us all the way from New York, Dr. Shuvendu Sen. He's a MD, nationally and internationally recognized award-winning physician, author, and speaker for the last 20 years. He's been honored by United Nations, American College of Physicians, and he's the recipient of the most prestigious Nautilus Award. Dr. Sen's works have been translated into French and several other languages. He has appeared on CNN, PBS, All India Radio, so it's definitely a privilege that he is with us today under Transliterature series platform. Recently, in fact, the Maharashtra government has also made an award-winning documentary on Dr. Sen. So we have the privilege of talking to the wonder doctor, I must say, whose very relevant book of our times, The Fight Against Alzheimer's, How to Prevent, Cure, and Care, and Hope, is making waves. It's been already recently launched, number 3 in preventive medicine, number 4 in neuroscience, and number 5 in mental health. Thank you so much, Dr. Sen, for making us today and giving us so much of your valuable time.
Thank you very much. Thank you for inviting me to your wonderful platform. I have been following it for the last few days, and it's a tremendous platform of literature, thoughts, very deep interaction. So thank you for having me. I'm truly delighted and honored.
So it's an honor, completely on our side, definitely. So, Dr. Sen, as we all know, Alzheimer's is definitely a most ruthless and most rampant disease, fast becoming a household disease and without cure. As you mentioned in the book, that it's like a serpent in the grass. It turns your brain into a jelly before you come to know about it. And you also say in one of your very good articles in Times of India that, we have beaten just when we thought we have beaten the dictations of the times and lengthened our longevity, we feel that we find ourselves still facing the monster. So what would you say about that? And why do you think there's so much of rise in the cases?
Well, a couple of points. We are definitely doing well. Biologically. We have got excellent medications. We have good amount of awareness now on various diseases. But what's happening, refreshingly, is we are now living longer and we are living young. All right, an 85-year-old 40 years back was much older than an 85-year at this age. But what has happened is that you know cognitive disorders, specifically of the Alzheimer's variety, they have a tremendous amount of unawareness that we now realize. It's not a disease of the elderly. It's a couple of myths that we need to break at the very onset. It is just that the manifestations of Alzheimer's, they come up at a very matured age. But the beginning of Alzheimer's actually takes place, who knows, maybe in the 40s, maybe in the 30s, maybe in the 50s. The only difference is that we do not have the right education or the awareness to find out those little, what I called as the hushed hints or the slender signs and symptoms of Alzheimer's. So this is a disease which is now manifesting more and more because we are living more and more. In the good old days, the back old days, we used to be, 75, 80 used to be our lifespan. Now we are easily living into the 90s. And as I said, we are living healthy, we are living good. But this disease is now emerging, and very interestingly, I mean, this was first documented well back, in 1902, 1906. You're looking at a good 120 years, and we are still scratching the surface. So yes, there's a lot of work to do. I'm calling it a pandemic. Technically, it is yet to be a pandemic, but I think it's a pandemic under the wings. The World Health Organization says that we have 55 million people with
Yes.
Alzheimer's, but this is Alzheimer's with an advanced stage. If you consider the Alzheimer's at an early stage, it could the it could be a billion. So we are facing a tsunami.
So you've given these statistics, which are really frightening. You mentioned 55 million cases in 2020, 78 million predicted in 2030, and 139 million predicted in 2050. And as you mentioned, that these are the cases which are already in advanced phase, and
Exactly.
you have so many under the threshold. Really a scary sight, considering that 8.8 million Indians are already beyond 60 have dementia. Sir, it's been a commonly asked question by our readers as soon as they come to know that a world specialist is going to be on a platform. And this is very relevant because, a lot of people don't know the difference between Alzheimer's and dementia. Somehow there is, people really want to know that. There's a lot of confusion between the two terms. Will you like to please give us a little?
Sure, absolutely.
Yeah.
No, I think it's a great question. I think it's a very relevant question. Alzheimer's is a type of dementia, and dementia is not a disease. It's an open ended term which includes memory loss, but it also includes lack of recognition, lack of orientation, lack of adjustment, all the regular things and the complex tasks that we very easily accomplish. The entire spectrum, the entire repertoire uh, makes it a dementia, the lack of all of these. Alzheimer's is the most common type of dementia. There are many other types of dementia. If somebody has a stroke, you can have a stroke related dementia. Someone has a Parkinson's, then Parkinson's related dementia. And I can give you a mouthful. There's another type of dementia called Lewy body dementia, something that Robin
Mm.
Williams unfortunately had. So there are many types of dementia, of which Alzheimer's type of dementia, which again is this whole spectrum of not just the memory loss, but this lack of orientation to time, to place, to
Oh my God.
person, lack of recognition, the entire collapse of the personality, entire collapse of the relationship that takes place. And again, I have said this in various areas where I talk and about its awareness and education, that we are just coming out of a pandemic, right? But in a COVID pandemic we got virus, right? So virus is something which is external. Or prior to that, let's say we had HIV, there's another virus external.
Mm.
Or syphilis, bacteria, it's external. But Alzheimer's is internal. It's almost like inherent. It does not flaunt. It crumbles us from inside. And hence its advent, its steps are very deceptive. It's a tiptoe, very tiptoe. It's like you are standing on a glacier and the glacier is slowly flowing and you don't realize that. So all we know about Alzheimer's in today's world is that I don't know where my bathroom is. I don't know how to start my car. Now that's a very advanced stage. But the beginning of Alzheimer's, is much before uh, this I don't know where my bathroom is stage comes in. So our entire challenge in today's world is to kind of anticipate this disease before it becomes a disease. If we can anticipate it, that it's there, then we can nip it in the bud, right? We can stop it right on the tracks. And in certain situations, we believe that with certain holistic preventive measures, we can actually arc it back. We can turn the clock back. But the real challenge is to get hold of it before it becomes advanced. Because when it becomes advanced, then as of now, we still don't have a prescription.
I've seen my mother-in-law suffering through this, through her years.
I'm
Now
sorry.
she's unfortunately no more. What are the initial signs? What is the most initial sign that you feel is the underlying, that you suddenly should take care of, start all the preventions that we're going to talk later on in the conversation. But yes, now, what is this little sign that you need to like really look into? I think that's going to really benefit our people.
Yeah.
Yeah.
You know, the couple of them. The challenge of Alzheimer's is in the variability of its presentation. The way I'll give you an example before I get right back into the question that you asked. Let's say about diabetes. For diabetes, the presentation is almost the same. You lose weight and then you have a lot of thirst, you have a lot of hunger, and that's very clear cut. But when it comes to Alzheimer's, or let's say a mind disease like depression, I know how a depression presents, but in Alzheimer's, it can be anything, and it's evolving. We are slowly understanding what its full repertoire is. To answer to your question, there are a couple of things that we think that we know comes at a very early stage of Alzheimer's. Sometimes we say, Alzheimer's starts in the bathroom. The reason we say that is because one of the senses that gets affected in Alzheimer's is a sense of smell. We lose the sense of smell. Now,
Yeah.
you can lose the sense of smell for many reasons. Even with advanced age, you can lose the sense of smell. Gradually, it goes away. But it's actually very sensitive for early stage of Alzheimer's. And we say that in the bathroom, for example, you have your body lotion and you love your body lotion because you picked it up for a certain fragrance that you absolutely love. And then you stop smelling that fragrance. That comes much before you do not recognize your family member, or you do not recognize your dining hall, or you don't know um, your right hand to the left hand. That's one of them. The other thing, which also comes in a very deceptive manner, is the loss of common words. And I've given this example a lot of times, like the same person who would say, I like to have an omelette, a bread, an orange juice, um, a toast, or a cup of coffee for breakfast, he or she would lose those words and would simply say, I like to have my breakfast. Now, it's a perfectly legitimate word. It escapes the attention of the family members, right? But what is happening is that he's losing those detailed words and covers it up with a much more common word called breakfast. But that is the beginning of Alzheimer's, where you forget the things that you always know, that you always talked about, and you just covered it up with another word which is much more common. So I say that forgetting the name of the capital of a city is not Alzheimer's. If you forget my name today, that's not Alzheimer's. But
Okay.
if you cannot recognize the glasses that you're wearing or Dr. Sen is wearing, if you don't know what is this called, that does not mean that you have Alzheimer's. But I'm saying that you should take it seriously because these things will come much earlier, much
Okay.
earlier than the dramatic manifestations of Alzheimer's. And what makes it very important is, every disease, they have a couple of phases. One is anticipation, next is prevention, then is cure, and then care. Now, we have a problem with the cure because we don't have the medication. So, in Alzheimer's, the money is in the anticipation. We got to anticipate the disease as early as possible. Then, those medications, which are not working today, might work if they are given at that very early soft stage. That's where the hope is, right? So, yeah, I can go on and on talk about this, but those are two of the major things that I have seen: the lack of smell and the loss of common words.
It's a very important tip. I'm sure it'll go a long way. And a lot of people who will be listening to this podcast as soon as it is put on the YouTube channel. We are talking about Dr. Sen's book, The Fight Against Alzheimer's, a very, very important book of our times. It's been published by Rupa Publication. And Victor Banerjee, the actor, he says that this book will definitely be an embracing scripture of understanding and hopes. Definitely a book to navigate through troubled times. So, but what inspired you after 20 years, even more, of being wanting to research on Alzheimer's, and you are a world known specialist? I mean, how do you think your perspective as an internationally known specialist helps in contributing to the conversation, and what made you really decide to write about this book?
It's interesting that you asked this question. I've always been a writer.
Yes.
While I'm writing, uh, I think my first nonfiction book was published by Times of India called The Doctor's Diary. And then prior to that, I published this collection of verses called Behind the Blue Veil. It was nominated for the Pushkar Prize in this country. But this particular book was with me for the last 40 years.
Oh my God.
It was just waiting to be born. And I'll tell you why. My grandmother was a very erudite, scholarly individual,
Yes.
and she wrote books. And she wrote a novel in verse on Lord Krishna. And it was published, and she was a very reputed author.
Mm.
At a time when women were measured by how well they raised their children, and that's it. Those were the times when she was also thundering the podium. She was a great freedom fighter. So when this lady lost her way, and did not come back for almost 48 hours. And when she was rescued, she was at the end of a lane, a blind lane, and she was completely uncovered. And she was just moving from one, like a pendulum from one end of the lane to the other end of the lane. And when she was rescued and when she eventually came back, she had no recollection of herself. She had no recollection of people around her, no recollection of me, one of her favorite grandson. And during that time, I was so young, it struck me that how could a woman with such tremendous scholarly aptitude can turn into a functional ruin within this couple of days? 40 years down the road, we still have the same question. See, I'm not saying we have conquered heart attacks, we have conquered cancer, but we have done tremendous improvement and advances in these fields. But when it comes to Alzheimer's, a disease that's sitting on us for the last 120 years, we could not move an inch. And it's now become a situation where that's why I call it a household disease.
Yeah.
Every 3 minutes, one of us are getting hit with
Yes.
dementia. So it's exponentially increasing. We think we know the reason why, but there are also other risk factors which we don't know. None of us actually can say that we are experts in Alzheimer's. Whenever I'm being introduced like that, I say, no, I'm not an expert in Alzheimer's. None of us are experts in Alzheimer's. This is a disease that's just still unfolding. This is a disaster that is waiting to happen. But we know that there are certain areas where we can target this disease. And those areas are very early anticipation and using holistic measures or the medications that are not working in the advanced stages. And hopefully we can reverse the tide.
It's mind-blowing, staggering. I mean, it is anyone who's seen a family member really, really can understand. I can understand your viewpoint, and you at least chose to do something about it. All your questions, I'm sure, got few answered too when you were writing this book. And you, as you say, there's so many still to be answered. In your research, did you really come across specific precautions or lifestyle changes that you already know, which you have put down, that individuals can adopt to reduce the risk of Alzheimer's? Few of them, I would suggest everyone to read the book to find out the entire story. But yes, today we can, perhaps discuss few of the
Sure,
precautions.
sure. I mean, in order to know what are the right ways to prevent, we also have to find out the risk factor. So unless you find the risk factor, you have to do the reverse thing. So there again comes the challenge because we don't have a risk factor, that we have nailed it. And I can tell you, you know what, ma'am, we nailed it. We got to do just the opposite, and we can stop this beast of a disease. Unfortunately, we don't have a proper, authentic knowledge on certain positive risk factors. Now, from obesity to diabetes to high cholesterol to stroke to everything, our situation in Alzheimer's is something like HIV in the 1980s, when we had absolutely no understanding of this disease and we started to demonize this disease. This is exactly what's happening. But of all the risk factors that we think we know, and the ones that we still don't know would probably one day evolve, what we now think that the mafia of the mafias, if I can say, the risk factor of the risk factor would be stress. And I'm not saying for the easy part of it. The easy answer is, yeah, stress always, crumbles the brain, etc., etc. Research actually, there was a landmark research that came out from Canada, where it specifically shows that those exact areas of the brain that gets affected in stress are those areas which gets affected in Alzheimer's.
God.
So we now have a very conclusive evidence that stress is probably the point of entry in for this monster of a disease. And you and I, we know very well that we live in a society where stress is promoted. In the corporate world, in the private sector, people want us to be competitive. Any competition is stress. So stress is almost legalized. Where we think that you're not successful unless you're stressed out and you perform under stress. So it is easier said than done, but I think the most important thing is the most simple thing to do, which is to de stress ourselves. Like, we do the work, we give our best. If it's good, it's good. If it's not good, we have other avenues to work. I tell this to my students, I tell this to my colleagues, I tell this in the community, that let's enjoy the work that we do, but let us not get stressed out. Let us not have negative thoughts. I mean, these are very holistic words, and we just take it for granted. It's written in spiritual books, but now we have put it under the microscope. Stress has been put under the microscope, and we actually know that stress actually is one of the major risk factors for causing. And then the other factors, diabetes. There's a new term. My last article in Times of India I wrote called as type 3 diabetes,
Yes.
because we think that insulin resistance can actually, or lack of insulin in the brain, can actually increase the chances of Alzheimer's. But then again, I will say all these words with a word of caution, because none of these have been conclusively proved. We think, evidences are showing, we think that obesity can hasten the chances of an Alzheimer's. High cholesterol can do that. Stroke, obviously, has been implicated. Parkinson's can do that. But I think, all said and done, stress to me would be the number one major risk factor, which can actually increase your chances of getting Alzheimer's.
Very right. And in your book, you've mentioned, you've given a lot of emphasis on meditation. This
Yes.
is one of the holistic approaches that you want people to approach. And you have a wonderful chapter also, like, I think I remember medicine without prescriptions. So, would you like to talk a little a bit about meditation part? You've given a lot of emphasis on transcendental meditation and everything. So, some bit of it. The rest we read in the book.
Well, all I can say, I'm no saint, but I think time has come for us to look into meditation as a prescription. Yes, it is a spiritual exercise. I mean, we all come from a country where meditation is our way of life. It is pursued in schools, in colleges, fostered in cultural circles, and we can understand the spiritual part of it. But meditation again has been put under the microscope, specifically by the Western scientists. And I'll just give you one of the many things that I've mentioned in the book, that it really came up in the 1930s, when someone called Hans Berger, a German scientist, is the founder of electroencephalogram, EEG, the type of different waves that we have. And he found out that in Alzheimer's, one of the waves that's missing, or is minimal, or is crushed, would be the gamma waves. And in meditation, we have found that these gamma waves are increased. There's a plethora of gamma waves. And this is just one example to show how meditation scientifically has been proved to help in Alzheimer's. As also the fact, meditation has been proved to increase nerve cells in our brain, something which is called, and I know I'm giving you a mouthful, it's called neuroplasticity. Neuroplasticity means the birth of neurons, and meditation actually does that. And scientists have gone into the depth of it. They now have imaging studies to actually see that meditators have tremendous amount of increased blood flow exactly in those areas which are
Okay.
hit in Alzheimer's. So it is not just a spiritual exercise now. I think we need to drag meditation, if I can show some audacity and say, we need to drag meditation out of a temple, and we just have to practice it as a prescription. Interestingly, in Harvard University, they have started a
Mm.
breathing program. When I was going through it, and I was very fortunate that in my previous books that I wrote on Alzheimer's, Dr. John Deninja, he's the chief of Harvard's Mind Body Institute. He played a big role in me writing the book, and he encouraged me to write it, and he was very happy with the book. They have actually started a Harvard University breathing technique. That
Mm.
breathing technique is exactly based on our breathing techniques that we have in meditation.
Yeah.
So, be it a simple breathing technique or transcendental meditation or mindfulness meditation, I think these things have come up as a prescription. And we need to prescribe meditation. I do that to my patients here also. And I
Yes.
say, don't take it as a religious exercise, take it as a pure scientific medicine. And a lot of things can be achieved with this. The problem that we face here, and I'll be very honest with you, we are so dependent on medications.
Yes.
We have a pill, you give me half a glass of water, I drink it, and I want the effect immediately. In meditation, it's not a sharp bend. It's it takes time. It's like a wide arc of a ship, so it takes time, and we are not ready to take that time. We are such an impatient race. We don't. So meditation is still an intellectual treasure in the universities. I think our challenge is to bring it down to the street and use it as a prescription.
So very well said. And even in this chapter, when medicine, that's my favorite chapter, when medicine is not about prescriptions, you mentioned that some of the drugs definitely contribute sometime or the other, like painkillers, like, few that you pointed out that really contribute earlier, maybe the early progression of the disease. And you are not a big follower of just prescribing the drugs over the counter. Am I right?
You're absolutely right. And again, I am a full blown, I'm a
Yes.
physician, I'm an MD, I prescribe medications. But as of now, we scientists, we are bending backwards
Hmm.
to come up with a medication. But I'll tell you why we are struggling. We are struggling precisely because of the fact, if you remember the way I started the interview,
Yeah.
it's not a one disease, it's a spectrum.
Yes.
So that spectrum, one of the spectrum is memory loss. It's just
Mhm.
one. The other is I can't recognize you. The other is I don't know what time it's. The other is I don't know where I belong. Am I in a room or am I in a hotel? So there are so many facets that gets involved, which means there are so many areas of the brain that gets involved. So it is almost myopic or short-sighted to think that I will have a one-line prescription medication which is going to cover all these areas. That's precisely one of the reasons why we are all struggling. And so that's why I'm saying that. And all these studies, they have been promising, don't get me wrong, but when we have done a longitudinal studies, we found that they are not curative. So we got to come up, we are working hard. I'm all for medicine, don't get me wrong, but till that time, or maybe even beyond that, the holistic measures needs to be adopted in order to prevent this from taking over us.
Extremely right, sir. All these are golden nuggets for everyone to follow, and I'm sure it'll make a difference to a lot of people. Your wisdom, your experience, and as you say, the field is evolving. Maybe some more things, maybe a second book later on from you on this. So it'll continue. You also say in the book that science has an opportunity to expand beyond its current boundaries if it embraces the eclectic ideas of spirituality. This is what you've said in the book too. So coming to your very important chapter, which was towards the end of the book, was we need healers, not doctors.
Oh,
That's
absolutely.
that's that's a very interesting chapter. A little
Yeah,
bit on that, please.
I tell my residents, I tell my house staffs, I tell my students that even in today's world of CT scan and PET scans and prescriptions, the finest instrument of patient care are our primordial organs, our eyes, our ears, our hands on the pulse. So, in our rush for the treatment of signs and symptoms, we forget the person behind those signs and symptoms. And
Yeah.
people come to us at a very vulnerable stage.
Hmm.
You know, they need that healing hand. I remember when I was supervising a couple of nursing homes when I was in North Carolina. So there was one patient, they said she never smiled. She was deep into
Hmm.
dementia. And I took up the challenge. And I used to sit with her and just hold her hand and squeeze softly, and she would squeeze back, and eventually, after a couple of days, she did smile back to me. So we need to give that time. So healing is a very important concept in treatment, because in a rush, we just scribble a couple of prescriptions and we write medications and we are out of the door. That is not taking care of our patients. So healing is a very important aspect. And I've seen that when it comes, let's go back to Alzheimer's. And I always say, when it comes to diseases like Alzheimer's, we all are doctors. The best doctor is actually the family member, right? So we all need to have that compassion and courage. The two of them, they need to be there. And a patient can only be cured wholly when treatment and healing, they go side by side.
Extremely well said, sir. That comes to the very important point of caregivers. which you've taken up very extensively, and you're a very, I can see that, very emotional person. You very sensitively handle that issues, because Alzheimer's, as we all know, robs a person of emotion, identity, dignity, and a period of, definitely, we have seen the Alzheimer patients with those emotionless stares, wandering away. And so caring for a loved one who's been so integral part of yourself with Alzheimer's suffering now can be definitely very emotionally challenging. I know that feeling because we've seen one patient in our family, and requires definitely a lot of strength, as you mentioned, unputdownable courage, especially when your own, very own, cannot recognize you. So, could you elaborate on the advice and support you offer in your book for caregivers? I know you've extensively mentioned that. And I think that's very important, because you don't have only one patient at that time, you have two, and the second one's because they're physically fine, not mentally fine, giving so much of time to the patient who's their father, maybe grandmother, grandfather, maybe a daughter. So, how does it happen? You've seen so many of them. You
Yes,
mentioned about so many of them, their spirit. Yeah, they give up also sometimes. Can't help.
sometimes they do give up, but it's first of all, it's hard. I won't mince my words. I've tried to give in my chapter on caregiver a lot of practical advice, a lot of um, emotional advice, but it's of course hard because you're looking at someone who was once your beloved and now cannot recognize you. Um, but before I get into this emotional point, I'll tell you why I wrote the chapter. I wrote the chapter because there is a very strong scientific truth behind caregiver burnout. There's a paper that came out from Brazil, and there was another paper that came from Norway, which actually shows, and they don't know why, they have not proved it, shows that caregivers of dementia patients, they themselves come down with dementia. And when they researched it, they found that, again, those areas of the brain that gets hit in Alzheimer's are getting hit in their brain,
Yeah, stress.
which is always, which is stress. There you go. You took the words out of my mouth, which is not good, which is not to say it's an infectious disease that it's transmitted, but it's the tremendous emotional stress. And now that we have proved the stress causes the damage in the brain, it is a very easy equation. So caregiving is very hard when it comes to a dementia patients. It is hard for anyone, for any other diseases, but for dementia patients, it's very hard because it is emotionally so exhausting. So it has to be done in a very, if I may use the word, in a very disciplined way, because I cannot preach happiness to you if I'm not happy. I cannot give confidence to you if I'm not confident. So I need to be confident. I need to have my own sources of happiness. We need to tell ourselves, and I tell every caregiver, whether it's a family member or a nurse or a social worker, that always tell yourself that there is so much you can do. You do not have to be the perfect partner because it is not the perfect situation. Your mother was your mother, but right now she's not being able to recognize you. There are certain things that you will do to your best, but you will also do it with an understanding that this is a new situation. I'll tell you one example. I've been asked that my mother has dementia, my grandmother or grandfather. What's the first thing I should do? I tell them, try to know what are the things you should not do. And the first thing that you should not do is to tell your mother, can you recognize me? You should never ask that. Because for someone who has lost her sense of reasoning, her sense of memory, asking her is actually hurting her dignity. And I can tell you something, of all the things that's destroyed by Alzheimer's, there are a couple of things that are not destroyed by Alzheimer's. Let's say the sense of art, the sense of music. And
Okay.
there's another thing, the sense of dignity. They may not express it, but every patient of Alzheimer's, deep down, they understand that they don't understand.
Oh my God.
And they cover it up with their smile. Their smile is not a reflection of happiness, their smile is a reflection of the dignity. and they want to be respected. They just can't articulate it. So to ask your mother, can you recognize your grandson? That's hurting their dignity. That's putting it on the spot. So what do? You actually say, hey, look, this is your grandson. It does two things. Number one, it preserves her dignity. And number two, it reinforces the memory. Right. So
Yes.
there are many things that I've discussed this in the caregivers is a chapter that needs to be done, which is helpful for both. I tell, again, it's easier said than done when patients come to me, family members, sorry, they come to me and say they're completely exasperated, and they say, my father is completely silent. He doesn't understand me. He's got into dementia. I'm completely choked in emotions. I said, turn the table. It's
Yeah.
a new relationship now. Just say that I am still not ready to understand the silent love of my father. So you just turn the table so that now both of us are in the same page. He can express, and you cannot understand her unexpressed words or silence. So you try to train yourself. So let's get into this new relationship rather than trying to put back. So the pain and the suffering all comes when we try to put it back to what it was before, rather than acknowledging it. Okay, it's a new relationship. My mom is still there with me. Deep down, my mom knows who I am. She
Yeah.
may not be able to express it deep down. See, love never goes away. Expressions go away, words go away. But deep down love, humanity is not that cheap. It's not that superficial. So deep down, everybody knows that there is acknowledgement, there is understanding, there is recognition. They can't just say it. If we can convince ourselves that it is there, then it is there. Right. So I take a lot of class sessions and lectures and behavioral therapies on that, and maybe another book I will just concentrate only on the caregivers. It's
Yeah.
hard, but it's also achievable. It's doable. It has happened in the past. Every time we have been pushed to the corner, whether it's a pandemic or a world war, we as humanity, we have turned around, we have hurled defiance, and there's no reason why we can't do it this time.
In your book, in fact, there's so many ways you've turned around the patients. They've started singing, the music's got them back, arts got them back. So we need to just have a better understanding of these patients.
Yes.
They
Yes.
are somebody's, as I just mentioned, very, very close. So you kind of need to turn the entire perspective and have that healing touch, that understanding touch. I know you're short on time, so we're coming towards the close of the conversation, but I have few questions still, so I'd like to wrap up as soon as possible. One very important thing which you really emphasized on the book is the role of precautions, which you say is the finest art of medicine. I mean, people don't really care about prevention, precaution, and it is really abandoned, orphaned, disregarded, and tossed to its side. So, some very important tools that you can mention. This is going to really help a lot of people. I know about them.
Well,
I've read the book, but few of them from your side. Yeah.
there are, most important prevention. Not that one is more important than the other, but again, I start by research
Yeah.
because people will accept more when I give a research evidence. And one of the many that I mentioned in the book, the one that I like to mention is the absolute necessity and the importance of exercise.
Yeah.
Exercise has been shown to actually increase some of the areas of the brain that shrinks in Alzheimer's. So I always tell my patients that run the mile. And if you can't run, you walk.
Yes.
And if you can't walk, you move your arms and legs. You
Yes.
know, if you have a pair of eyes, wink. So some sort of motion is priceless, and it helps. Now, there are many other evidences which are coming up. I'll say the one that I've been asked all the time about the type of food. There's a
Yes.
type of food known as the Mediterranean diet. The
Yeah.
Mediterranean diet is actually all about fruits and salads and fish and olive oil and legumes, etc., etc. They are actually considered to be, they have been found to prevent this on rushing episodes of dementia. I've always talked about walnuts. I'm a big fan of nuts, and then coffee. And
And
I've said
also a
that,
little bit of red wine you mentioned.
and a little bit of red wine. It's not going to harm. It is not going to harm, and it has been shown that they help. And coffee. I mean, coffee might increase your blood pressure, but coffee has also been shown. Then cocoa has also been shown, and through various research works, that they prevent these things from coming. And of course, music. I'm a big fan of music, and I'm so tempted to tell you a story.
Yes.
It's less than a minute, where I remember I was called to see a patient, and the patient was in deep, semi-coma state of dementia, and I had to take some fluid away from her belly, and it was midnight, and I was trying to take the fluid away, and then I realized that my cell phone was on, and somebody had to call me, and but that
Yes.
night was 24th of December, and I had changed the tune of my cell phone to a very profound spiritual song, Joy to the World, the Lord hath come. And he
Yeah.
started to play. And I could see from the corner of my eyes, my
Um,
patient's eyelashes started to flutter. And then she whispered, "Is it Christmas, Doc?" I said, "It is Christmas,
oh
Gloria."
my
She
God.
said, "Merry Christmas, Doc." I said, "Merry Christmas, Gloria."
Oh my.
So it's just so, see, and then the music stopped, the phone died, and she just flipped back to her coma. So you look into that reach of music
Yeah.
as a primordial language, how deep it can get into the brain. So I've mentioned all these in my book, and these are live examples that I had in my life. So music is a great preventive measure, art is a great preventive measure, and so on and so forth.
There's so much more in the book. Maybe one last question, sir. I know you have to rush back to your patients. You're on a call, and so thank you so much again for your all your time. But as a physician, author, and advocate for Alzheimer's awareness, what is your long-term hope for the impact of your book on the global conversation surrounding Alzheimer's disease and dementia care?
Awareness, awareness, and awareness. What we lack in today's world is the awareness of this disease, which can, if we all get together, we can cure ourselves. I always say Alzheimer's is not a solitary disease, it's a family disease. It's a disease that needs courage and compassion. When it comes to Alzheimer's, cure and care must walk hand in hand. Love and respect must walk hand in hand. Art and science must walk hand in hand.
Thank you so much, sir, for your kind words. It's been such a wonderful conversation around the book, The Fight Against Alzheimer's, How to Prevent, Cure, Care, and Find Hope. And I really thank Rupa Publications for putting us together. It's been such a
I'm
amazing.
very indebted to Rupa Publication. I'm very indebted to its chief editor, Mr. Dibakar Ghosh, and the whole team
Yeah.
for being with me in this whole journey.
Thank you,
And thank
sir.
you very much for inviting me. It was a pleasure.
Same here, sir. And please subscribe to our YouTube channel, Trends Literature Series, and we connect you to all the wonderful authors. And today's 40th episode could not have been complete, could not have been so great without the presence of Dr. Sen. Thank
Thank
you.
you so much.
Thank you, sir.